Mutual support. Mutual support is the giving of resources and task-related efforts to another member of a team with the intention of helping this team member obtain their goals that is defined by their role, and this occurs when the team member is failing to reach these goals. So mutual support entails helping one another, giving and receiving feedback, and emphasizing patient care above all else. Task assistance is a part of mutual support, which is when team members give and receive tasks, and this fosters a climate of teamwork which is best for patient care.
What is feedback? So feedback is information that is relayed to a team for the sole purpose of improving their performance. There are two types of feedback, formal and informal. Formal includes scheduled in advance, focusing on reviewing past events, and it has a quality based on assessment of value, such as in collaborative discussions and individual performance reviews. Informal occurs spontaneously or in real time, continuing on a regular basis instead of a one-time occurrence. It hones in on improving knowledge and development of practical skills, such as in huddles and debriefs. Feedback provided is deemed effective if it is given at an opportune time, such as soon after the occurrence of the targeted behavior, respectful, keeping it professional and not assessing personal traits, specific in all aspects, what needs to be improved, such as the task or behavior, intent is for improvement, which is preventing something from reoccurring, and considerate, which is being mindful of the receiver's feelings when conveying constructive criticism. It is important to advocate for a patient at all times, but especially when viewpoints of team members and leaders do not align. Assertion for advocacy of an alternative action is to be carried out in a firm and respectful manner. The concern at hand and a solution should be stated to try to reach an agreement.
So the assertive statement allows people to voice their concerns and suggestions and ensures that critical information is addressed. So there's usually a 5-step process. So you open the discussion, you state your concern, then you state the problem, which can be real or perceived. You offer a solution, and then you obtain an agreement. The 2-challenge rule is presented when someone responsibly voices their concerns, and they must do it at least 2 times to ensure that it was heard. And the challenged member must acknowledge that they heard someone challenge them. If your outcome is not acceptable, you take a stronger course of action, and you use the chain of command by going to people higher above you to come up with a solution. The lack of safety should result in an immediate stop of the process, and safety issues must be fixed before anything can continue. CUS are the words that you should only use when you deem appropriate. So you state, I am concerned, I am uncomfortable, and this is a safety issue.
So there are 2 different types of conflict that exist within teams. There's informational conflict, which is a result of when 2 different people have different information, and this conflict can be resolved using the DESC script or the 2-challenge rule. And there's also interpersonal conflict, which occurs when 2 people have a conflict because they are being hostile or harassing, which is also resolved by the DESC script. Conflict resolution, the DESC script. The D stands for describe the situation, E is express your concerns, S is suggest alternatives, and C is consequences identified. So a few things you can do are have a discussion, work on win-win solutions, frame the problems using your own experiences, always discuss your problems in private, not in public. Try not to place blame and use I when you're describing your feelings. Don't criticize and focus on what is right. Some of the tools and strategies of the mutual support. Just a few of the barriers are hierarchical culture, ineffective communication, conflict, distractions, and defensiveness. And then some of the tools and strategies are briefs, huddles, debriefs, cross-monitoring. And then the outcomes include shared mental models, adaptability, team orientation, mutual trust, team performance, and patient safety.